I believe is understanding your role, your responsibility. When people say you are the city's doctor, how can I be the city's doctor if I don't know the city and the city doesn't know me? And how can I represent Chicagoans if they don't know me and I don't know them? So I had to spend more time in the community and getting to know the city than spending time in my office behind a screen. That I thought was priority for me because Chicagoans had to feel like I was connected, that I understood their context, that I could represent them, and I know the issues. And I cannot know the issues by just sitting on behind my computer. I know the issues by interacting with people and building relationships. So if that means going to a church on a Sunday and just hanging out with people, then that's what I got to do.
Welcome to Community Level, the podcast where public health research meets real-world impact. Brought to you by the Community Health Sciences Division of the University of Illinois Chicago's School of Public Health, we bring you real conversations with researchers, practitioners, community leaders, and organizations working to create healthier communities. Let's dive into today's episode.
Hello and welcome into the show. This is Community Level. My name is Dr. Kalechi Bay-Lamberts, and we have a fun episode for you today as we're going to be talking with the Chicago Department of Public Health's Commissioner, Dr. Olusimbo Ige, the first African woman, to be in this position, the city's doctor. I was going to say the community's doctor, but the city's doctor, as she self-proclaims herself. So we have a fun episode. This podcast, of course, is brought to you, powered by the Community Health Sciences Division at the School of Public Health at the University of Illinois Chicago, the only public health school officially in the state of Illinois. All right. So you find this podcast anywhere you listen to your favorite podcast. Spotify, Google, Stitcher, and now we are available on Apple as well. So as I promised, time and time again, we were going to make sure that we cleared that hurdle, and now we can find this podcast anywhere. And you can also, of course, find us on YouTube, but I just want to be able to give you all a heads up that YouTube is strictly audio. There is no video. So if you want to watch us, you won't be able to see us, but you can still find this podcast, the entire episode, on YouTube, the entire season so far on YouTube. This is still season 1. And we are moving along swimmingly. So thanks to all those that's been supporting. Please, if you are listening to this for the first time, be sure to rate and review the podcast. Give it 5 stars. Leave your comments. Let us know how you feel about us so far. We are taking all that into consideration as we continue to build and grow, and look forward to wrapping up this season and getting into the next one. All right. So I don't know if our guest needs too much introduction. If you simply Google her name, you will see it as the head honcho, the leader right now for the Chicago Department of Public Health. Dr. Olusimbo Ige joins us on the show. And I mean, this was a very relaxing, very just cool conversation to have. We get to talk a little bit about just her life. And she tells us, her growth and her journey from Nigeria to the UK and to the US, and just how she continues to build momentum. And that's essentially the theme of this conversation that I have with Dr. Ige, is that it's just about the small momentum that lead to big outcomes. And so she tells us about her personal story, and we get to be a little nosy and learn about all the things that she does to try and relax and help herself. But we also, of course, get to feel that same passion that some of y'all, if you haven't heard her talk or met her before, you'll see, and it's very palpable even while listening. She is, and when I say she is everywhere, she is everywhere. And so just a major salute to Dr. Ige, especially as we are actually in Women's History Month. So this is just so fitting to be able to release this episode at this time and be able to share with you a great story about somebody that's making a great impact and very passionate about this city, and has just grown so close to the city already and has taken this city to heart. So we have a great conversation, just very relaxed. We don't get too much into the nitty gritty of public health in the city, but we really just kind of want to learn about her, the person. And I think we accomplished that. And I now want to be able to bring you in on that conversation. So let's bring Dr. Ige on the show and have a conversation. Hello, everyone. I'm very, very excited to have on here our very special guest taking the time to sit down and talk with us here on the community level, to meet us on that level. We have the Health Commissioner of the Chicago Department of Public Health, Dr. Olusimbo Ige, who is joining us right now. Thank you so much, Dr. Ige, for joining the show.
Yes, Kelechi, it is such a pleasure to be here. I am excited. Thank you for having me.
Yes, yes. And we are excited as well to just learn a little bit about, actually, a lot about you. We really want to know, first and foremost, just your journey, right? I think a lot of us who can easily go on the internet, we can find your CV, but I want to know, and I think we all want to know your journey. So if you can share with us your journey as to how you got here, and and how is it like being there?
Yes. Well, my journey to Chicago, that Chicago is the greatest city in the world. That's what our mayor likes to say. And how did I find my way here?
Yes.
I will say I came here by way of New York, and before then, I started my journey. I was born and raised in Nigeria, Southwest Nigeria, in Ibadan. I was born in academic environment. Both my parents are in academia, and I grew up in a university community, University of Ibadan. And I think the most distinguishing feature about me is curiosity, just asking questions why. Very early on, growing up in Nigeria, you're faced by a lot of health issues and premature mortality and all of that. And always been curious about why that is. And just knowing inside me that I could contribute, I could help. So I chose medicine for that reason. And very quickly in my career, I realized that I was seeing a lot of preventable issues to all of the places where I'd worked. So I became again curious about, can we prevent these issues? And that what led me to preventive medicine as my specialty. And again, as I saw more and more of the issues that were prevalent around me, I started again being curious about the policy environment, the investment, the economic conditions that drive some of the issues that I was seeing. And that prompted my exploration of the international nonprofit world, USAID, working to support in many different states, building public health programs and how to design them and how to evaluate them and how to budget for them and how to hire people for them and how to train people for them. And eventually I got to a stage where I thought, I'm doing all of this work in sub-Saharan Africa, but a lot of the decisions about what happens in global health is being made in other spaces. And I truly felt like I could contribute to how those decisions were being made, because I felt there was a disconnect. Those folks who are making these decisions don't really understand the context. I understand the context, so maybe I can help with the decision making.
Yeah.
And I came to the US because of that. My family had been in the US, but I thought this is where decisions are made that impact so many countries. I want to be part of those decisions so that those who are impacted can get the benefit of someone who understands the context.
Yeah. Yeah.
And that's been my story. I want to bring my lived experience. I want to understand the context. And I want to use that experience to help inform decisions for those who look like me and to help improve health generally. And so one thing after the other, I came to the United States, worked for international profit for a while, and again begin to realize that the things that I was seeing in the global health context was also very prevalent here in the United States. So I thought, again, my experience in the global scene could be relevant in the local scene. And so transitioned to the New York City Department of Health Center for Health Equity and Community Wellness, and had a very interesting adventure there, just building, the community engagement, health equity infrastructure. And when the opportunity came to come to Chicago, again, I felt, what will it be like if someone who is very attuned to the context, understand the lived experience of navigating a complex system in the United States, who will be part of the decision making? Will that help our communities? I thought the answer to that was yes. And that's why I came here, because I felt my experiences, my lived experiences, particularly, will be relevant in the Chicago context, especially because of the huge inequities that we're wrestling with here.
Yeah.
And haven't tackled that in the global scene, haven't tackled that in New York successfully. I thought I could bring those learnings here to Chicago and help be a part of the solution.
Wonderful. And so within that journey, and I know you've kind of had experiences, like you said, trying to understand the context and providing the context. What do you say is the most pivotal? What do you think was the most pivotal moment in your journey in your career that really shifted the gears for you to really commit to that particular path that you took?
I will say it was there. There are two moments. Around 2014, 2015, every woman, every child had a challenge trying to reach children with life-saving intervention. And we had, and the international profit that I was working with then had committed to reaching 1 million children. And we have started this initiative working with several countries, trying to ensure that every child that is conceived can get born safely and can live to their fifth birthday. And our hope was to get to 1 million. And when we got to 1 million, it struck me that change is possible, that no matter how grandiose or unimaginable some visions are, that change is possible. We reached 1 million children, and these children were able to survive until their fifth birthday because a group of people dared to dream. And then in New York, when we were facing COVID, and we had a vision to close the vaccine equity gap, and we were mobilizing the communities and working with everybody, and we just continue to see the numbers, converge and converge and converge until vaccination coverage in Black communities or the Task Force for Racial Inclusion and Equity community caught up with the rest of the city and actually overtook the rest of the city. So these were the moments in my life that made me realize that the inequities that we face are reversible. That with commitment and some creativity and partnership, things can change. And that is the optimism and hope and realization that drove me to this job, because I know that things can change and things can get better and inequities can be resolved. And we've already begun to see that in Chicago. So because we know that change is possible, and we're already seeing it happen.
Yeah. So just a little bit more about that, the journey. I'd be remiss if I didn't mention, of course, that you are not only the first Black woman, but also me as a fellow Naija boy. Go carry last. Yeah, and so it is. You're the first Nigerian woman as well to be in this position. So what does this milestone mean for you, professionally and personally?
It is just such a privilege to be able to occupy this space. I was looking, I am the 36th, I think, commissioner. I was looking at the history of the city, and in our hallway, you will see man, white,
Yeah.
and then boom, after a while, we started to see, one Black face and etc. And to be given this opportunity to serve, it is just such a privilege. But to be an immigrant Black woman, given that privilege, it's even doubly significant to me. And so, there are folks who are a little frustrated with the American dream. And I want to say to everyone that I believe in the American dream. I believe that this is a country where, as long as you keep putting one foot in front of another and opportunity meets preparation, there is opportunity for change.
Yeah.
I wasn't planning to be a commissioner. I never even dreamt of it. But when the opportunity presented itself, I was able to step into this because I had those little wins that gave me the confidence that I may not have the right accent. I may not have the right pedigree. I may not have gone to the Ivy League colleges, but that I had what it takes to be part of the solution. And I was very excited to be given this opportunity to serve. So I just want folks to know that, again, like I said at the beginning, change is possible. Opportunities do come our way. And if we grab it with both hands, like, I think it's the Niger spirit in us. We just keep trying. We
Gotcha.
hustle and we
Yes.
try and we
Yes.
try and we never give up. And that's what I tell everybody. Don't give up, just keep trying. And one day the doors will open.
Absolutely. And the doors did open. And one important thing that I want the listeners to hear you say is that you use the word serve. Even being in that position of leadership, I think sometimes we don't understand that there is servitude that is part of this position. And I think, honestly, this may be a remedial question, but I think for those who are listening, what does the commissioner do? I think what is the day-to-day activity of a commissioner? Because I think people just think that you're just one or guy at the top and you're
Yeah,
sitting,
no.
But what is the day in the life of a commissioner for the Chicago Health Department? If you can give us a little peek inside the,
Snippet.
yeah.
Yeah, it is. It's a very interesting job. There are many different components to it. A big part of my job is leading the staff of CDPH. We have about almost 800 staff at the moment. We have 22 office locations and setting the strategic direction for the work that we do, and working with the executive leadership team to ensure that our staff have the resources and a strategic direction for the work is a big part of my job. Now, the second part of my job is engaging with the community. I am responsible for ensuring that the needs of 3 million, almost 3 million Chicagoans are met. And that means I have to understand what those needs are. And so a lot of community engagement, I have to do a lot of, events in the community, go to faith uh, houses of worship, go to community events, um, speak at different events, opening speeches and presentations and all of that. That's a huge part of my work. Then connecting with the city leadership. So we do a lot of subject matter hearings with the city council, with the legislature, engaging with the leadership of the city, the mayor's office. I am supposed to be an advisor to the mayor on public health issues. So when there are issues, consulting on what are the best pathways forward to address these issues that the city is facing. Sometimes we have huge responsibilities like the Democratic National Convention, where we will be hosting hundreds of thousands of delegates, and we are responsible to keeping them safe. So leading that process, making sure that every T is dotted and every I is crossed, and then building partnership with healthcare institutions, institutions of learning, public health institutes, the state, the local, the county, building those partnerships. So we have a lot of intergovernmental task forces. We have a lot of coalitions and spaces where I go represent the department in those spaces. So those are some of the major things that I spend my time on each day. Most days I'm not in my office. Most days I'm out on the field at different events.
Yeah.
And then you have to deal with hundreds of emails every day as well. So that's a reality.
I'm actually glad you brought that up because I was gonna say, I mean, for someone even as someone as me who like returned back to Chicago after journeying across the different states, I felt like you really hit the ground running. I was like, Dr. Ige is here, Dr. Ige is there. Like you were really visible, and I was going to ask, like how were you able to do that? How were you able to really hit the ground running and really make yourself very visible across various communities, from going to like the Latch and Stroll, and you're speaking at a you're
Correct.
speaking at commencements, and so how were you able to, how were you able to come into the position and really just hit the ground running like that?
I believe it's understanding your role, your responsibility. When people say you are the city's doctor, how can I be the city's doctor if I don't know the city and the city doesn't know me?
Mm.
And how can I represent Chicagoans if they don't know me and I don't know them? So I had to spend more time in the community and getting to know the city than spending time in my office behind a screen. That I thought was priority for me because Chicagoans had to feel like I was connected, that I understood their context, that I could represent them, and I know the issues. And I cannot know the issues by just sitting on behind my computer. I know the issues by interacting with people and building relationships. So if that means going to a church on a Sunday and just hanging out with people, then that's what I got to do. And if that means coming to Latch and Stroll, and go visit those who are trying to make, build things in the community, I want people to feel that I am there and I understand, and I will advocate and support them in all of their different endeavors. And so that's a priority for me. That's something I love to do. And I hope that people, sense that we care about our communities and we are in the communities.
Yeah. So one are some there are lots of great things that are happening, and there are also a lot of challenging things that are happening. But what are some specific initiatives that you are in your position at the time you've been so far that you're very proud of, you're very encouraged by? What are some specific initiatives that you have going on that people should be encouraged and excited about?
Yeah, Chicago Department of Public Health is, a top-notch health department, a lot of recognition and awards. So this is just building on what already was there. But one of the biggest challenge we had coming in was, the migrant situation where people were coming in.
Yeah.
And initially that was not thought of as a health issue, like, oh, we just need to provide people housing. But once you start putting people in congregate spaces, we know as public health, physicians, that things start to bubble up. So helping to create an infrastructure for that, for the public health infrastructure for that, and being able to respond to one of the largest outbreaks of measles in the entire country. And, the largest outbreak we've had in 30 years was one of our huge success stories. It was not just that we were able to respond, it was at how we responded and how quickly we responded. I'm going to be giving a talk, at CDC about how our response reduced the probability of hundreds of cases by 69-fold. If we hadn't responded within the time frame that we did, that outbreak will have extended for at least 10 more weeks. So again, this comes from knowing the potential for a highly communicable. Measles is one of the most contagious illnesses that we have. And once you hear that that is happening, 9 p.m. that night, I was in the shelter at 10 p.m. that night. Within an hour, we're there on the ground. And that is the promise we've made to Chicagoans. If there is a disease outbreak within 24 hours, we will be on the ground responding. Some of the other things that I noticed was like the life expectancy gap in Chicago was one of the draws for me. And so when I came in, I started looking at what are the drivers of the life expectancy gap. There's some things that are getting better, some things are getting worse. The opioid overdose was one of the things getting worse. And we know that summer is when this happens. Yeah. So that's, again, one of the first things that I do. How do we prevent this from happening this summer? We see this every summer for the last 3 years. We don't want this to be replicated this summer. So we started to mobilize, and I encouraged my team, we're going to go door knocking. We're not going to ask people to come to us. We're going to go to them. And so I was there with my son on a Saturday knocking on doors and saying, I'm the commissioner and I'm here to tell you about opioid overdose. And we went door knocking, over 1,000 blocks in the West Side, telling people we can stop people from dying. And this summer, we reduced opioid overdoses by 23% and reduced mortality by almost 50% in one summer. Again, because we centered communities that are most impacted. We're doing the same thing for our work in maternal mortality and infant mortality. Where are the issues concentrated and what can we do different? Lead has been, an issue that people have been worried about. And so we say, how can we be a bit more proactive? The way we get information about lead poisoning right now is when children are screened at 12 months, 24 months, or 36 months. But that means that the child already has lead in their blood, and then we are notified, and then we'll then go and remediate. But what happens if we can be proactive? How can we proactively identify that and not wait until the child has lead in the blood? So these are some of the changes we're making in terms of how we do our work and how we prioritize communities that have been underserved. And in 2025, we're now developing an action plan and say the communities that have the lowest life expectancies, we want to change how we engage there. And we have developed an action plan for how we're going to do so. So these are some of the ways we're tackling the problems: infectious diseases, chronic illnesses, heart disease, opioid overdose, homicide, violence prevention. These are some of the priorities that we're working on, and we want to do it a little different, do it with the community, and do it in a hyper-local way that saturates communities with resources and information. And it's just not dependent on communities coming to us. We will go to them and make sure they're connected to the services that they need.
Yeah. Yeah, and I mean that's very evident in some of the things that CDPH is doing with the Healthy Chicago 2.0, working the different
Right,
health equity zones, and
right.
really showing that you want to build relationships on a regional and a community level with partnerships, and that's been very evident. But that's amazing to hear that in one summer you were able to decrease mortality by almost 50%, which is
50%.
that is I mean 50 that's
I
half,
know, I
that's
know. Half.
that
We
is
went from
in
1,000 deaths to like 522.
that is incredible. And so, how do you, in your role? I mean, I think you've discussed it a little bit, maybe, and as far as you being on the ground and working and really, leading by action, not just by words. But I wonder as well, for someone who's overseeing a large, very organized and impactful department, how do you continue to keep your or how do you plan to continue to keep your team, your department inspired to continue to move forward and do the work that you all are doing and continue to make that impact that you just described?
I think public health can be very challenging. You need a lot of optimism in public health because, a lot of the problems we tackle are just deep-seated, long-standing problems. So, but as leaders, we're dealers in hope. We cannot build an army with guilt and shame. You have to build an army by showing them that a vision is possible. And that requires small wins. We have to be able to tackle some things that we have control over and demonstrate to people that we can do this and we can succeed. And the more people succeed, the more motivated they are to take on larger projects. So a lot of my work is showing people opportunities for quick wins. There are deep problems, there are social determinants, there are structural racism and systemic issues. And those issues, the pace of progress is slower. We will continue to address those issues, but in the short term, there are things that we can change now. In the moment, there is no reason why someone should die of an overdose now when there is Narcan. Now, they may be unemployed, they may have housing issues, but in this moment, right now, we can solve for that while we elevate other issues. There is no reason why people should still die of COVID or flu when we have vaccination.
Yeah.
In the moment, we can solve for those things. So it is elevating to people opportunities for making an impact now. And I think people find joy and in fulfillment in being able to see the change we're able to make in our community because we are from the community. You know, CDPH staff are representative of the Chicago community. So their ability to see the change, incremental changes, I think it's very inspiring for our staff. And that's how I lead with wins and successes. There's also a need for adaptive leadership skills in public health because so much of the work we do changes minute by minute. It's influenced so much by policies, influenced so much by budget, and we had so much funding during COVID. A lot of that funding is going away. It is very easy to get discouraged and say, oh, we don't have all the funding that we need. But what do we need? I'm an asset-based kind of person. And how do we adapt? How do we build partnership and collaboration to achieve the things that we do? For the opioid response, we had to work with 41 different organizations to join us. If we try and do this alone, we cannot win. And we may not be able to pay all of those organizations, but we know these organizations share the same values as us, and they came out. And together we were able to really change the trajectory of what was happening in some communities. So these are opportunities, again, helping folks to see where opportunities lie, how to leverage the assets we already have, and how to celebrate the small wins while we continue to advocate for the big policy changes that our communities need.
Yeah, I definitely agree, and I adopt the philosophy of the small wins and building momentum. I do think that when you get that small win and you continue to build through and through with your small victories, you have confidence. You feel like you can do it, right? That confidence, it continues to drive you. You're like, we can do it. And there's power in the collective effort. So when everyone feels like we can continue to celebrate when there's momentum, so that's a very important piece. I hope the listeners also appreciate and adjust. All right, so one more thing before we start getting really nosy and into your real and getting really into your business. One of the things that I know about your career is that you and you just talked about it again, but you served in a role as like working for a foundation like Robert Wood Johnson. And I know you also discussed working in New York, but being on that side where you're working in the private industry and you are the one allocating funds and determining the funding for different initiatives. And now you're kind of on that other end, right, of the public sector. And so what do you think is the significant difference? I mean, there's some that are obvious, but what are the significant difference that you experience in both? And how have both sides, how have you been able to take your experiences to kind of help one side compared to the other?
That is a big, big question. It's a very huge difference. In
Yeah,
philanthropy,
yeah,
money is not the issue. There's money, and your issue is where do we invest?
yeah,
So on that end, it was really trying to prioritize where we make the most impact. What can we invest in that nobody else will invest in? So a lot of brainstorming, a lot of strategy and thinking. We were not mostly in the doing realm. And many times, we had the privilege of being able to dream big and hypothesize and say, in an ideal world, we will do all of this. So that's the exciting thing about the world of philanthropy. It is a completely different scenario when you are on the ground in the front line. You come from that 360-degree view at the national level to then come to a local health department at the city level, and not just any city, Chicago. Uh, and why Chicago? I said my draw to Chicago was life expectancy gap, and the life expectancy gap in Chicago is double the national average. So in terms of health equity and the challenges, this is one of the biggest places for change. But in the public sector, there is no one person making decision. It's like layers of decision making. Government is structured when you're working with other people's money. There are layers of approval and layers of stakeholders to convince and to get everybody on board that this is the best thing to do. If I choose one neighborhood over another, then you're gonna hear it. It's like, what about me? What about me? And what about me?
yeah,
So it is a real challenge in building consensus and building relationships, and I say that in local public health is not just the science of public health, it's the art of public health. How do you engage with people who are not public health professional, who are not even maybe from the same background or same worldview as yours, and sell public health to them? And that is what we do on a day-to-day. Communities who say, you know what, I'm not interested in vaccines. How do we bring them on board? Or, if we're working with our city council who may have different views about what we should prioritize, and we say, you know what, from what we're seeing, from the numbers we're seeing, we think we need to prioritize certain communities. How do we bring them along? Or if there are political realities of we want to change what our priority is at the federal level. How do we sell the local reality to the federal folks who are not seeing what we're seeing every day? So these are the things we wrestle with in local public health every day, that is very, very different from you're at a national level
yeah.
deciding where to put money. So I have enjoyed it. It has taxed me and challenged me in a lot of ways, but it is such useful work to be in the front line of public health.
Yeah, no, that is awesome. So, okay, we're going to shift gears a bit, and so with everything that you're doing, what keeps you grounded? What keeps you sane?
Um, I have an amazing family. I have an amazing family. I don't think it can be fully effective if I didn't have the support that I have. Um, I love to laugh. I just, I love people, the same way I enjoy being in the community is how I enjoy hanging out with my team in CDPH. And we have such interesting people. We have fun. We're doing Halloween costume, or we
Yeah.
are, you know, testing new food during the National Hispanic Heritage Month. I love to interact with people. I think it removes some of the tension and the big responsibilities you have to just be in the moment with people once in a while. And that's how I diffuse tension. Um, and I have, just a huge community of support in Chicago. I think everybody has been rooting for me, wanting to offer support. What can we do to help you? We want you to succeed in
Yeah.
this role. That has been just such a blanket of warmth for me. The
Yeah.
Midwestern hospitality
Yeah.
is real, is genuine in
Yes.
Chicago. So I am never lacking for recommendation like restaurant I want to do during the weekend and how to unwind and places to visit. And so that has been a something to always look forward to on the weekends. Like I have always something happening that I can explore with my family or with, the larger community.
Yeah, yeah. So what are some places that you've enjoyed so far with your family? I know you mentioned like you've taken your son in the community to go knock on doors, but I'm sure your son also wants to go to, he wants to go to some place, wants to go
We
downtown.
have gone to games. We have gone to, the Cubs game. We
Yeah.
have gone to the Social Field Museum to watch Messi. We have tried the different food scenes all the way from the far south to the north. We have tried all the different cuisine. I just heard that there's a Ghanaian restaurant, on the north side that I'm going to explore. So we try everything. We are real foodies, so we just
Okay.
explore all the different, and there's so much to choose from in Chicago. It's just amazing. And summer was so exciting. There was always something going on, during summer. So we had a lot of fun just exploring the city. Um, and I will begin to do the suburbs also a
Okay.
little. But in the city, I've just been I want to touch all 77 community areas
Yeah.
before I'm done. And I tried the food in every different community area. That's the goal. So I'm working my way up, that list.
Yeah, yeah. No, interesting. I be in the summer. Have you? And I don't know. Do you plan to go to Ghana Fest? You mentioned the Ghanaian restaurant, but have you heard or plan to go to Ghana Fest anytime soon?
I haven't heard of it.
Oh yeah,
Uh,
it's a big thing in the summertime.
uh,
You need to go.
yes. I would love to go to that. I've gone to Nigerian American Professional Association events and
Napa, yeah.
Nigerians in diaspora events and the Black physicians events and so many different things that have been happening.
Yeah. No, that
I
that
went to the Filipino American nurses event, and so I'm just loving it, just exploring the diversity in Chicago. It's amazing.
I love that. And so, would you consider that your form of self care, or do you do something your own to like self care and just separate yourself from everything else?
Um, every once in a while, very rarely do I have like just me time.
Hmm.
So I relish that when it happens. I mean, Veterans Day was like one day where I was alone in the home, just reading a book. And there it is one of the things I love to do to unwind and listen to music. I'm a great music person.
Okay.
So, but I just love culture and music and exploring the museums and all of that. That's mostly what I do when I have free time, but every once in a while I'll be like, today I'm not going anywhere. I'm just putting up my feet and listening to music and reading a book.
So, what was your favorite? What's your favorite music to listen to? Your favorite musician, if you want to share that too.
Yeah, so so this is gonna date me a little. I'm a great, uh Aretha Franklin
Okay.
fan. And Whitney Houston fan as
Oh yeah,
well.
yeah.
So I listen to a lot of my old jams from before and sing it from beginning to the end. And so, when I have chores to do, I play my mixtape from 19, whenever. And I've carried that mixtape from country to country, and I still have it.
Oh my! Like, well, Whitney does it. Whitney is one of my favorites. So if you say Whitney,
I
we
know,
can one of
I
all time
know.
favorites. A whole album, and even of course being a Nigerian, I came Celine Dion. We know what that is.
Yes,
So
yes,
like,
yes.
we all understand Celine Dion is that
Yeah, I
we
know.
have to.
So we have a mixtape and we carried around forever.
All right, so to kind of wrap things up, and thank you so much for your time. I do want to kind of close things out by having you share, with our listeners, especially for those who are aspiring to be in position like you are in the future, or or anything close to that. What is an advice that you wish you received in your career moving forward, and then what is an advice that you'd like to give to any young professionals, any young black women, young black, young professionals in general that are in the same situation or aspire to be where you're at?
Yeah. I want everyone to know that leadership is not just about a title or a position. It's about your ability to influence change, no matter where you are. And, today we talked about just small wins and building your muscle
Mm.
in leadership. And so sometimes people feel that because I don't have this title, I have not become commissioner, I'm not a leader. And I don't believe that that's true. I see many young people doing amazing things. I met a young lady yesterday saying that she was developing, an app for how to bring exercises to people at home who cannot access physical therapy.
Mm.
And, a young lady just not even 20. So people, you can be a solution in so many ways in whatever little space that you're in. Don't let anyone tell you that because you don't have a title or you don't have what you think is a formal position, you are not able to contribute to change in your community. At wherever you are, in whatever little way, where you ever you have an opportunity to contribute to the solution, please do take that opportunity. And the more you do that, the better the world becomes. If we're all doing our little bit wherever we are, I believe that our country will be better for it, our world will be better for it, and we don't have to wait until you get to be a commissioner or some big title before you feel like you have the power to make change happen. We have power on the inside of us, and I think we should use it.
Yeah. Oh wow, that's very powerful, and I think that's a great way to drop the mic and end that. But Dr. Ige, thank you so much again on behalf of us here at the Community Level Podcast. Thank you so much for taking the time to just even share your time and your story with us. We're very appreciative. We're very grateful here at UIC for just the partnership that CDPH has with us, and we continue to grow in that area. But we are, just like you mentioned, we are rooting for your success. I am personally rooting for your success. We want you to win.
Thank you.
We want you to continue to keep those wins coming, and keep the momentum going, and let's see that change happen. And just thank you for being on the ground with us, on that level
Thank
with
you.
us. Thank you so
Thank you.
much.
Thank you. Thank you for the space, Kelechi. You have to send me some recommendations for things to explore. So.
Don't worry about that one. Don't don't worry about that. We'll handle that. It's that one we organize.
Thank you so much. This has been fun.
I hope you all enjoy the conversation. I'd like to give a special thanks to Dr. Ige for giving us her time in such a busy schedule and just being very transparent, very open with us about her experiences and her leadership role, and even her personal life a little bit, and just the things she enjoyed. And I appreciate you being able to allow us to get to know you a little bit better as you continue to do the great things that you do for our city. So special thanks again to Dr. Ige and the Chicago Department of Public Health for just everything that they're doing and for their partnership with us. And so again, if you like what you heard, please be sure to continue to check out the podcast and continue to subscribe and download. We really appreciate your support. But that's going to do it for now. I'm going to sign off. But I very much so look forward to talking with you again on the next episode, which might be our final episode right here on the community level. Until then, take care.
Thank you for tuning into Community Level. If you enjoyed today's episode, don't forget to subscribe, leave a review, and share it with others. Join us next time as we continue to explore the intersection of research and community action. Until then, stay connected and stay level-headed.